corona epidemic as we know it is over. In the evening Israeli channel, Khan reported that for the first time on January the 18th, the Homefront Command's COVID testing facilities will be closed and that the COVID tests will be transferred to the healthcare services and it'll be their responsibility. The second date received by the healthcare services is January 31st. That's a next milestone when the coronavirus will be considered a viral disease similar to the flu. The control center for the pandemic will be closed, and at this stage, there'll no longer be a need for isolation for COVID patients, and that's according to this plan. The healthcare services protested this schedule, and they asked for more time, and they asked for a budget, and they're waiting for some more instructions in writing, and all of this is assuming that the next government will adopt this workout plan. Joining me live now is Professor Cyril Cohen. He's the head of the Laboratory of Immunotherapy at Bar-Ilan University and a member of the Advisory Committee for Clinical Trials of the Coronavirus. Professor Cyril, thanks so much for joining us. My first question is, what is the ramifications of calling this a flu, just no different than any other cold?
Yes, I think that the idea is that, this is what we've been fighting for, meaning that we were hoping that we will get to a stage where we're talking about an endemic disease, meaning that it doesn't threaten so many lives as we knew in the past. We hoped that, and we are still hoping that, our healthcare system will be able to cope with, those winter infections, including COVID. So basically, I think that it is a change in the state of mind. But, we see that, outside, people are not wearing masks. People are not, I would say, even getting tested officially. We know that there are a lot of infections, of cases of COVID that are not detected because people are not going to be tested. So basically, we are more in a scenario in which we are behaving like with any other viral disease in the winter.
But Professor, there's still the ramifications of the disease itself. It still kills people. I mean, my father passed away from COVID there are others who are dying from COVID every day.
No, definitely. I'm not saying that COVID is over, and I'm against that. We're not saying that COVID is over the same way like flu is not over, but flu is also killing people, unfortunately. And right now we are, trying to assess the threat. The thing that is, I would say, so far different with COVID more than other diseases is that we see also long COVID and long-term influences of that infection in certain people. So I think that we are now in a transition period, but I want to be cautious. We are always at the mercy of a new variant, though we haven't seen, major variants appearing in the past, I would say, a few months. Something can happen, especially in light of what is going on right now in China.
Correct. That's the question I was going to ask you, Professor Cyril. We don't know the next variant, the next particular strain that may be more deadly, and we're breaking this apparatus down. Isn't that a danger in doing that?
To some extent, yes. But what if not? Should we continue? And if yes, until when should we continue with these policies, et cetera, et cetera? No, we think that we need to be flexible. And I think that Israel has exemplified how we can be flexible in terms of policy. So I think right now, if the situation we are seeing is the same as, it has been for a few months, if we see a certain stability, because I have to remind you that the number of severe cases is more or less stable, and I hope it will stay the same during the next few weeks, we need to do something, and we need to better consider how to use our resources to fight other diseases that right now are also threatening the healthcare system and the population.